Welcome back, everyone, to another PTPearl from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about Turftoe, which can be pain right kind of at the base of that big toe. How does it happen and what to do once you've injured this? Let's check it out. This is something that can be so much more debilitating than it sounds. Toe injuries, face value, don't sound like, oh, that's not a big issue. It's just a toe.
But we walk on it.
Especially our big toe, which is what Turftoe is an injury to the big toe. And we walk over that, and every movement we do when we're standing on our 2 feet relies so much on our big toe, even just balancing. So we're going to dissect through why this is such a big injury and how to kind of rehab yourself back. But before we do that, comment below. Has anyone ever heard of Turftoe? Have you had Turftoe? How did it go? Are there specific things that you want to hear about it or questions that you have? Please hit that notification bell and the subscription button before we get into this, because it just helps us so much more get the information out to you that we put out.
This is really looking at the big toe, and it's a hyperextension injury of the big toe joint.
Yeah, so hyperextension, toe coming back towards the shin. And what happens essentially is the soft tissue structures, or the structures that support that joint. It's our MTP, or metatarsophalangeal joint.
Good job.
Whatever that means to you. The metatarsals are the long bones in our foot. The phalanges are the bones of the toes, so MTP joint. And there are a bunch of structures that stabilize that joint, especially at the big toe. The most important being the plantar plate. And the plantar plate is just this thick bunch of capsular and ligamentous structures that essentially is reinforcing that big toe joint, because the big toe joint is so important. Every time we walk, every time we run, go upstairs, we're pressing our full body weight through that big toe joint. We tend to see this type of injury, particularly in athletes. That's where it got its name, Turftoe, when they started introducing turf in football. Actually, it's a harder surface than natural grass or soil surfaces to play on. And a lot of athletes were noticing they were getting this pain in that MTP joint of the big toe because of pushing off on the harder surface. A lot of people were spraining this area. So where we'll see it is people who do a lot of impact activities, especially impact activities where you might not be wearing footwear that supports that MTP joint.
Enter gymnastics.
Right? Gymnastics is one that I was thinking of, where you're barefoot, but you're doing a lot of explosive stuff, jumping, putting a lot of pressure through your toes. And people who are in non-athletic events, even runners, even people who are doing more of those impact exercise type activities, or it can happen in trauma, car accident type situations, falling from a height and landing on your feet, things like that.
Yeah, so we just want to kind of go through the different grades of injury, and then we'll go through kind of different overall treatment protocols. However, it is best, I would say, to get guidance from a physical therapist in person as you're going through such an intense injury. So that is going to be our number one recommendation.
Grade 1 is just a minimal strain of capsule and the ligaments around that MTP joint. There might be minimal tenderness, swelling, no visible bruise or anything though. And we don't see that because there was no actual tear or disruption of tissues, and your toe would likely still have full range of motion. It would just have that slight pain and tenderness.
So ice, right?
Well, ice can always be something to help modulate the immediate pain response.
Yes.
But we don't always want to live in that space. We want to be able to do active things to make sure we maintain our range of motion, start introducing some strength or resistance to that big toe. So we did an episode on, is icing effective? And the acronym is Peace and Love Now, which spells something out. Rather than rice, which was rest, ice, compress, elevate. It's all passive things where we need to have a little more active treatment, even in these lower grade sprains where you're doing active range of motion. You're starting to stand on your feet a little bit, lean into that toe and see how it feels. And all of it is going to be based on your own symptoms. But yes, might take a little bit of initial modification of your activity, resting for a day, just to see how the pain responds, and then starting in with some active mobility and loading of that toe joint. toy joint.
Toy joint. Then we go into grade 2. So now we have more of a partial tear around that plantar plate. So with like a complex strain around like that ligaments area, but without articular injury. So we're not getting
any injury to the bone.
Right. We're kind of just staying right around where those ligaments kind of connect around that plantar plate. And so we are going to see some swelling. Now we're going to start to see some bruising and sometimes, you know, some reduced range of motion, difficulty weight bearing. And we really want to start to go into some stabilization type exercises when we're going into, you know, going from that peace and love to then start to load it just a little bit more.
Yeah, and we're going to go through kind of the treatment protocols after this. But grade 3, then we're moving into a complete tear of that plantar plate that we were talking about. Also rupture of the capsule ligaments. Then we might even see some sesamoid bone fracture. The sesamoid bones are on the bottom of that big toe area. It's kind of the knobby ball type things you'll feel. You also have them in different areas of your body and some maybe subchondral bone bruising. And again, this is a spectrum. So these seem like very definite categories, but you can always land somewhere in between them.
But in grade 3, we're definitely looking at an operative.
Grade 3 might be more of the operative path because lots of structures there involved, and we might need to have surgical operation to stabilize that joint. Phase 1, and kind of said some of these things a little bit, and this phase 1 through 3, this is more applying to, like you said, grade 1 and 2 strains, right? So if it's a very mild grade 1 strain, you might work from phase 1 into phase 2 relatively quickly. You know, you might be getting to phase 3 after 10 to 14 days and then looking at return to sport versus a grade 2 injury. You might take quite a bit longer in phase 1, which is the calming down phase. So we're avoiding putting a lot of excessive stress on that toe in extension, especially early on. We're not wanting to do a lot of aggressive loaded toe extension. We want to limit the stretch to that area, maybe even taking smaller steps. I know with some more severe grade 2 injuries, you might even look at having a walking boot or something that limits that toe's ability to even go into extension and flex. There are some cases where having crutches might be appropriate for the first amount of time until we're calmed down.
This is
phase
like
1.
the first time you're going to hear us say, don't go into Vivo barefoot shoes.
Right.
Don't go into your barefoot shoes.
Yes, Vivos definitely promote extension because they're so flexible.
Yes.
And then there are some exercises.
And that's looking at more like toe curls. So maybe we're doing where we're putting our foot down and we're kind of dragging a towel in toward us. You know, we're working on things like short arc, which is actually really hard, but pressing the toes down into the floor again, creating that stability, and then trying to pull the ball of the foot toward the heel and trying to create that contraction right at the base of the foot by pushing the toes down into the ground. And then gradually and passively, probably at first, we're going to be working into our big toe mobility, but really doing that super gently, making sure we're not going aggressive and going into pain.
Yeah, and big toe mobility, yes, there's extension, but we can also start working general toe mobility, like toe spreads, toe abduction and adduction, because again, that's just going to be strengthening those stabilizing muscles around the MTP joint without further irritating the plantar plate. Then we move into phase 2, which is putting stress back on that injured toe, moving more into that extension. So big toe extension repetition, sitting and using your hand to bring your toe into extension. How does that feel? Does it feel okay? Great. Let's put our feet flat on the ground and try to actively go into extension. How does that feel? Great. Then you can move on to other things like calf raises. You can even do that seated. So you're not putting your full weight through that foot and do a seated calf raise, which is going to cause your toe to go into a little extension. Then we progress to maybe standing calf raises,
supported single
legs with support, even just doing like a standing lunge where you kind of lunge forward. Your back foot is going to go into that toe extension, but we're really not doing anything explosive that's going to put kind of the maximal amount of pressure through that joint.
We have a finger there by the big toe as we're pressing it down, or do we have a resistance band that we're kind of working as we go into extension and then back into flexion, you know, getting that full range within the control and the active portion so that we can go back into more functional exercises, then going into increasing more load when we go into phase 3, because that's where we're really going to start to get into more load. So now we're getting into plyometric orthopedics are starting to add bouncing to the area, to the toe, and do more of that loaded type of extension.
Yeah, which this could look like a lot like what we did in phase 2 with calf raises, lunges, different loaded activities that cause you to go into some big toe extension, but do it with weight.
Yeah, or just don't do it supported anymore. Like, don't hang on to something. Like, it's hard.
Doing a Bulgarian split squat with your toe flipped under. And these, of course, are going to be a lot more aggressive into that toe extension, but this is what we're going to want to do to be able to build the resiliency up in that toe. And then plyometrics, there's tons of different plyometric
type
of jumps we can do with lateral bounds, even just like you said, starting with hopping 2 feet, starting with 2 foot straight up and down hopping back and forth.
Agility ladders, stuff like that.
Agility ladders.
Yeah.
Those are all things that would work into the mix. Again, with what's your end goal function wise? Are you somebody who's wanting to get back to running? Somebody who's wanting to get back to pickleball? Always keeping that end game in mind. What are the activities you want to get back to, and how can you start to simulate that in a more controlled environment to be able to build the strength, stability back up in that toe so that you feel confident to get back into your activities of choice.
Really, we use Gen Health preventatively as well. So even if you don't have turf toe, starting to take note of what is my big toe mobility? Do I have strength through my foot? Can I even do that short arc or spread my toes or bend at my ankles? We start to lose this ability if we're not actively going into it. And so if you want to check out the foot and ankle plan, you can start a free week on Gen Health. We'll have that linked up below. It's just gen.health/free trial, but you can use code OPTIMAL and it's going to give you $5 off the first month. And so if you were consistent, the first month of Gen Health, you can get through 2 phases of the foot and ankle plan and really start to see how this progresses you. And you have so much more available on Gen Health as well if you want to go beyond the foot and ankle too. Thanks so much for joining us on another episode. Hopefully that was informative and helped you to understand the progression of what you start to look into. And when you're talking about getting back into your activity of whatever that is for you. And of course, if you want to listen back on those previous episodes, like the episode on ice or anything, we'll have that linked up as well so that you can check that out.